The topic of our research paper is the impact of antidepressant in tech industry by medical history and interpersonal factors, and systematic review and meta-analysis. The authors of the research paper are Samar Verma, Manishka Parita, and Diand. So, what these are the topics that we are going to cover in our presentation: introduction, objective, application and scope, methodology, proposed methodology, effects of antidepressant, results and recommendation, and conclusion. So, talking about what is depression. Depression is a mental health disorder which is characterized by a persistent feeling of sadness, hopelessness, loss of interest, and pleasure in activities, often accompanied by physical and cognitive symptoms. It is a mental health condition that affects a person's thought, emotion, daily functioning, leading to difficulties in carrying out normal activities as well as maintaining relationships. Recognition of the mental state of a person is an important subject of research to avoid any unfortunate happening. Curing depression requires a comprehensive approach tailored to each individual's need. Effective strategies often include psychotherapy and consuming antidepressants. Now, the objective of our research paper is data analysis and machine learning to predict the depression, which is based on the medical history as well as interpersonal factors of employees which are working in the corporate world. With that analysis, we are also going to analyze the side effect of antidepressants which are taken by depressed people, as there are no long-term as well as short-term side effects of antidepressant that affects their work also. So these are the two objectives that we have covered in our research papers. Now, the application and the scope of predicting depression. First is informing antidepressant prescription. Giving proper information to patients for taking medications of antidepressant and the side effects while taking or be prescribed prescription of medicine so that the patient will not suddenly stop taking medications. Personalized treatment plan include with a better understanding of how medical history and interpersonal factors influence depression. The model can assist the mental health professionals in tailoring the treatment plans for individualized patients. Guiding health policy decision. In various tech industry, there are many policies for health also. AI-powered mental health apps. The model can be integrated with mobile application to provide the users with personalized mental health assessment, self-help resources based on the medical history. Then the mental health awareness campaigns. The model's finding can be used to raise awareness about depression risk factors and encourage individuals to seek help. Driving further research. That means that as we have done so much research on antidepressants as well as predicting depression, our model will help people to develop their model and apply changes according to their requirements.
So let's see the methodology of a research paper. We have studied various research papers and there were various type of data sets like text-based, social media, psychological and demographic factors and analyzed different algos such as logistic regression, KNN, SVM, AdaBoost and various different algos to predict depression. For better understanding, we ourselves implement various algo on their data set and got the results according to that. After implementing that, we analyzed and found various limitations related to dataset and algorithms, and we measured the depression using depression scale, screening scale to categorize various types of depression and scale them. So let's see how machine learning algo works. Let's take depression dataset in which first feature selection is done and then dimensionality reduction min-max scaling is done by various methods. After that, data is pre-processed and splitted into training and testing part. On training data, various machine learning algorithm is applied to train the model, which is SVM, Logistic, decision tree, SGD classifier, and there are many more also. For after that, the test data is going through the model evaluation. We use test data for predicting depression and check whether it is giving correct results or not. We can use hyperparameter tuning, which allows data scientists to tweak model performance for optimal result. So let's see the proposed methodology. After analyzing multiple algo for depression detection, we found ensemble methods as the most effective for predicting depression. And also it is not explored yet, so we try to use new algo and research on that. So ensemble methods are often considered effective for depression prediction and many other tasks also. They leverage the collective wisdom of multiple models to make more accurate and robust prediction. And ensemble methods tends to be more stable and robust against fluctuations in the data and model choices. Even if one model performs poorly in certain situations, the overall ensemble can still maintain its accuracy.
While going through around 100 research papers and studying 25 of them, we found a research gap which we tried to solve in the second objective of our research paper, which was the effects of antidepressants on the long term effects of on the individual. So first was body mass index. So initial empirical evidence indicates a possible connection between the SSRIs, antidepressants, and weight gain in overweight adolescents. So this discovery emphasizes the importance of conducting further investigations into the impact of antidepressant use on weight increment in various pediatric populations. The second was sexual desire and behavior. The use of antidepressant during childhood has been linked to potential disturbances in the normal development of sexual desire, particularly in women, which can significantly affect the solitary sexual desires in women too. The third was suicide attempts. So, in a comprehensive study encompassing a large cohort of adolescents from across the United States, the use of antidepressant medication was found to have no statistically significant impact on the probability of suicide attempt. This finding emerged after adjusting for treatment allocation based on propensity and controlling for various other factors in depression detection. Fourth was educational and health outcomes. So, children experiencing severe mental health conditions that necessitate the use of antidepressant exhibit unfavorable outcomes in various areas, including the education and the health of an individual. Specifically in boys, although antidepressant use is less prevalent, it is associated with poorer outcomes. Fifth is quality of life. The use of antidepressant in adolescents diagnosed with major depressive disorder (MDD) has shown positive effects on overall functioning. However, when examining the impact on quality of life or QOL, no significant positive outcomes were observed. Now, coming to the results and recommendations. So, the first result of our analysis is the depression class was particularly tricky to classify. The classification of the depression class can pose significant challenges due to several intricate factors. Firstly, depression is a complex mental health condition that lacks objective measurement, so making it challenging to define clear boundaries for the classification of depression. The second was machine learning algorithms are powerful generalizers and predictors. So one of the key strengths of ML algos is the ability to generalize from a training data set to making predictions on new unseen data. So by gaining knowledge from a diverse set of examples during the training phase, the algorithm captures underlying patterns and relationship in the sample. The third was pretty much every model was able to accurately recognize over 80% of the true negatives. Mostly the almost perfect models were at determining the depressed class. The faulty they were at determining non-depressed class. The fourth was tree-based models are not the best for this task, and linear models perform the best. One possible reason is that the relationship between the input features and the classification of depression may be better captured by linear model. Linear model assume a linear relationship between the features and the target variables, making them suitable when the decision boundary separating depression from non-depression cases can be approximated well by a hyperplane. Now, lastly, the conclusion. According to the research gaps identified by us, we explored more models and new techniques like ensemble learning that suited the best for predicting depression using patient history. And usually neglected factors such as medical history and interpersonal factors are crucial for accurate depression prediction. Lastly, we have studied the effects of antidepressant on factors such as body mass index, sexual desire and behavior, suicide attempt, and educational and health outcomes and quality of life. Thank you.